Hey everyone, Dr. Jason West doing a live cast on healthcare things. I'm doing a little bit of a break on this pandemic because as the social distancing is supposed to kick in and it seems like we're getting ready to open up the country and some other things. It's not that the coronavirus isn't important, but I will say this. When we get on top of that, which it looks like it's going to happen, guess what's coming back? Arthritis, fibromyalgia, chronic fatigue, myalgic encephalopathy, Lyme disease, peripheral neuropathy, the stuff that we've been doing inside the West Clinic for a long time. And I'm excited to share with you one of the stories off our blog, A Daily Dose of Vitamin H. What that is that's our patient success stories. It's not me just saying things that are happening. And I'm really excited to share with you a story about Laura. Laura was coming into the office thinking that she had chronic knee problems that was going to require surgery. She tried everything in the medical world, and she came here 2 years ago, and I'm so excited to share with you her story. And before I forget, you guys, let me just tell you this. Thursday night, we're doing a live question and answer period on YouTube Live, on Facebook Live. We did our first one last week. It was epic. How to live, how to eat, what supplements to take, questions from everybody. I think we went over 30 different patient questions on the last live cast that we did. I want to invite you to that Thursday night, Mountain Time, 7 o'clock. And remember, everything that we're talking about with Laura and regenerative injection therapy is available in a book called CuringArthritis.com. It's the Arthritis Cure. It's something that we've put together. Here I want to show you this is what it looks like. It's a free ebook on the cause of arthritis and how to put it in and the pain and discomfort, and the treatment conditions that I wish I would have known about 20 years ago when I got out of school. I'm so excited to share that with you guys and for you to meet Laura. So check it out. Here's her story.
And they just hurt all the time. You'd never know I was in so much pain 2 years ago.
Yeah, I think. Everyone, it's Dr. West and Laura at the office. We were getting ready to do some work on a different body part for Laura, and she said, hey, by the way, I got to tell you about my knees. So, Laura, what were your knees like before you came to the office?
Before I came in, they just hurt all the time. Really painful to walk, especially stairs, and to spend very much time on my feet.
The medical options or suggestions before you came here, did they tell you to take over the counters, or was it a joint replacement surgery or pain? What were your medical options before you came here?
We tried cortisone, and that didn't work. So then my next option was complete knee replacement.
And this was how long ago?
2 years ago.
So then we started on a treatment program. What treatments did we do at the office?
Here at the office, we did prolozone and platelets.
So everyone, that's a combination of regenerative injection therapy with a shock absorber. So we're taking blood out, we're spinning it down, pulling out the platelets, we're mixing them with a vitamin and oxidative medicine treatment. And Laura, what happened?
It was, it's just been progressively better and better. It's actually been a year since I had the last aggressive treatments. And I've had just a couple of maintenance since then. And you'd never know I was in so much pain 2 years ago.
Yeah, I think the only thing left, there's a little bit of clicking on one side, but like the pain's gone, you can get up and go downstairs and you're relatively normal.
Yes.
Okay.
Yes, life is more back to normal.
So an amazing outcome, someone bone-on-bone arthritis, they said you need joint replacement surgery. We did the regenerative injection therapy. It's a really nice story of hope. Laura, is it okay if I share this with other people?
Yes.
Okay, so Dr. West and Laura at the West Clinic talking about the arthritis program. You're not your diagnosis. Even if the bones are touching, there's things that we can do. We'll see you guys on the next video.
Came in, they just hurt all the time.
All right, so you guys, that was Laura's story, and I'm excited to tell you exactly what we did for her. So the most important supplement for people to take, the most important vitamin, the most important mineral, is the one that you need. And that's exactly what we did for Laura. She got some cetyl myristoyate. We balanced out her complete metabolic panel. We looked at her inflammatory markers. We also gave her some Joint Revive, which is really good food for the joint, and then it was the regenerative injection therapy. Now what that is a combination of vitamins and some oxidative medicine, and then as she said in the story, there's some platelets in there. So you pull some blood out, you spin it down, and you get it into a specific little matrix. It's like putting a shock absorber in the area, and what we were able to do is to make it so that she did not need the joint replacement surgery that she thought she was going to have. So I'm really excited for people to be aware of that therapy, and so it's in a book called the Curing Arthritis is the website you get at it. It's the book, The Arthritis Solutions in 2020. It's a whole program that we put together. I'd love for you to get some information on that. I'm so excited for you guys to be able to come back and talk about real life after we can get some further advances on the pandemic. But there is a way to help you with your healthcare conditions, whether it's fibromyalgia, rheumatoid arthritis, mixed connective tissue disease, osteoarthritis, psoriatic arthritis. There are some solutions that are not in the prescription pathway that are really, really effective for people. And then just as a reminder, Thursday nights at 7 o'clock is our live cast. It's our question and answer period. We did it last week. It was on Facebook Live and YouTube Live, and it was absolutely fantastic. It was epic, and we're so excited to offer that again. We went through about 30 different questions with people. Thursdays, Mountain Time, 7 o'clock on Facebook and YouTube Live. This is Dr. West, and we'll see you guys on the